Hello, this is Dr. Aanchal Panth, and today I will tell you everything you need to know about female hair transplantation. Though hair transplantation is more commonly done in men, more and more women are coming to us seeking this treatment. There are certain basic differences when we approach a female for hair transplantation as compared to when we approach a man. In men, the patterned hair loss is mostly due to androgenetic alopecia, whereas in females, they have diffuse hair loss. So we must always ascertain the cause for their hair loss. We have to make sure that it is female patterned hair loss and not chronic telogen effluvium or diffuse alopecia areata, which can masquerade as female pattern hair loss. So in women, we do certain blood evaluations such as checking for their thyroid profile, looking for their iron levels, and also certain vitamin levels to look for any underlying vitamin deficiency. And also we do biopsy in cases when we are a little doubtful. Biopsy will help in delineating the cause for hair loss, and also we can make sure that it is not a case of diffuse alopecia areata. There are certain basic differences when we approach a female for hair transplantation as compared to when we approach a man. Our aim with hair transplantation is very different when it comes to men and women. In men, we can change their look completely and give them a very dense look. But in females, our main aim is to make the scalp less visible. So we want to give them a good improvement from baseline, but will not be able to restore complete thick hair. This difference in gender is because in men, they have a very good donor area which is intact in their occipital area. As in females, there is a diffuse thinning of hair, so the available number of grafts is also less. We have to utilize the grafts in the most effective way and plant them in the area which will give the best cosmetic outcome. In women who have thinning of hair on the top of the scalp and widening of the area when they part their hair, we can plant most of the grafts in this area in order to give a good coverage. So in women who are more bothered by their wide forehead, we can kind of lower their hairline. A lot of women also complain of temporal recession. In this area, they have a very see-through effect and which gives them a little bit of bald look. We can also improve density in this area. So before we go for the procedure, you must discuss all the styling options with your treating surgeon so that you get the best outcome. You can decide a hairstyle and you can decide the side in which you like to part so that we can plant more grafts in that area in order to give a better coverage and better density. You must understand that whenever we go for a hair transplant procedure, we need to plan for the future as well. We cannot plant a very large number of grafts in a small area and deplete the grafts for future use. We have to be very careful of how we plant the grafts and make sure we are planting in the area which will give the maximum effect and the best cosmetic outcome. Unlike in men where we do a full head trimming, in females we only do window trimming for hair transplantation. So it will not completely change your look. After the procedure, you will need to cover your head maybe with a scarf or a cap for a period of 7 days. For a period of about 7 days after the procedure, you'll be given a normal saline spray to spray every 2 hourly. On the 7th day after the procedure, we give you a head wash, then you can resume your normal styling. After the hair transplantation, you'll be able to appreciate the results after a period of about 8 months to a year. Hair transplantation in women can be very rewarding if done correctly for proper indications after detailed counseling and planning. I hope you found this video useful. For more videos like this, kindly subscribe to the channel.